It's a short video, but it's very, very knowledgeable video. So a lot of women up there, they come to the clinic and they say, oh, you know what? I experienced this kind of sexual, how am I going to say that, contact. And yes, you know what, I'll be honest with you, I never believe in myself till I get to the situation, whereas the guys or girls specifically go to this profession with be contact with people, and it's kind of like, I'm sorry, but this is like fetish stuff, and it's all those small places. I don't want, like with the red lights, this is the high percentage of get those, or like a girl's going to the guy massage therapist in his house, in his apartment. You need to make sure you read the review about this guy. He's a social active, he's a social open, and he's not like, you know, one of those massage finder websites, and this is all you can find him. So he have to get his information everywhere and the show. So what happened to you? If it's happened to you, first of all, it's the manner of talk. You know, the therapist is always keep the distance, and he's always talked about more medical stuff. And he's not palpating glutes, he's not palpating chest. So that's what the girl told me. The guy come in, he stepped close to me, he start talking like this, and like, you know, sniff her. It's already first signal to you to, like, hey, I'm sorry, I don't feel good. Oh, like my stomach is, I have to get out of here. And if you want to report it, of course, report. I mean, on this kind of stuff, I will probably not report. I just leave it and just pay attention to this guy, what's going on. Just notify people and let the people know to not get in this trap, because this is really unpleasant. So what's the most therapists do, like not supposed to do? It's when you lay down, they said, don't cover yourself. Like the girls come in naked, right?
What? Is it happening?
Yeah, no, it's just what it is. Yes, you see, Jana's he's massage therapist also, so we just use her as a model. So if the client is just one sheet, it's no cover sheets, it's no towel, you just undress, you lay down, it's already gonna give me that signal. And I see a lot of videos right now when massage therapists massaging, and the purpose lift that, you know, body up so you can see that piece of titty or the butt. We're a professional manual therapist. For me, it's not the body. It's the, how am I gonna call that? I am artist. It's the mod. I have to get that mod back to the looks like a human. I don't see it as a naked body. I see it as a muscles, as a structures, as a joints, and that's is what the professional therapists will do. They will do intake form for you. They will send the paperwork. And that's as important. If it's nothing is happening, it's some tutti frutti massage place when you can get some maybe disease if they not cleaning. So maybe like it's a lot of percentage they're not cleaning. Plus you get that unforgivable sexual what's the call? How are we gonna say that? So yeah, contact. If you're looking for something like that, yeah, you're welcome. But if not, you always looking for a medical therapist. Okay, so let me show you what's not appropriate in massage. First of all, if person lay down, go ahead, lay down. You can do in the shoes.
Face up?
Face down. Let's do face down first. David is going to record us.
Which way do you turn on?
No, it's just like this.
Yeah.
Here we go. So what's that? It's usually covered. We don't take she's not lay she's laid down on the both sheets. We have 2 sheets. That's fine. So I see what the therapist doing. They start massaging. This is the red flag when they start working on that glutes and the head's going inside. All you can do, yes, the massage therapist can pump that glute just like that. You see? But go inside the leg, it's inappropriate, and something is not right. Sometimes we do this decompression of the spine or sacrum. I'm always okay, I'm going to touch your sternum. I always let the client know what I'm going to do. If it's get close to the genitalia, to the butt, relax, let it go. You see, she's not relaxing. She's like fingers is like in the claw. So always, yeah. So always try to relax your client in the beginning, especially if it's the first time. And like I said, if this is happening, if this is working on that area, this is red flag. It's also sometimes I see the guys going under the shoulder. This is the fine position because you're holding the shoulder and you work with that shoulder. But when the client, the therapist is going under your chest and touching your chest and pulling, grab the chest and pulling you, this is wrong. So it's not appropriate to touch that the chest, especially the nipple. And also for the guys, you'd be surprised how many massage therapist guys been attacking in Los Angeles. They come in, they tell me like, hey man, this is, what do you do in this situation? And I always say, if something in situation, the client is start harassing you, all you're gonna say, you know what, I'm stop the session, let me pack my stuff and leave. And that's what you warning him once, or if it's not happening twice, so and you leave. But this is not about the customers. Next one, it's face up. Go ahead, flip face up. It's a lot of, so that's what the girls tell me. So that's what the guy did. So also what he's did, he's pulled his leg up and he started massaging this pubis area. It's not appropriate. It's nothing to massage it up there, only if it's specific treatment and you go to specific therapist. Sometimes it's a coccyx adjustment or that pubis adjustment, which is not going that way. So every time the massage therapist is going that across that bikini line, that's mean it's inappropriate. It's something sexual. Sometimes, yes, we work on that lymph nodes right in this area, right in pubis area, but it's like I said, it have to be draped and it have to be notified before the therapy, and during the therapy you have to explain what you're doing. If it's not happening, it's a red flag. The chest area, we do work on the chest. You recording us? Yeah. Okay, can you see this? So the chest is usually pecs muscles. It's the upper portion of your chest. So if the therapist massaging this upper chest, it's absolutely fine. So if I'm doing just like that, so you see, sometimes I push the breast a little bit down with the sheets. I can cover, of course, and I'm working on that sheets. If I come up in the lower portion of the chest like this, it's something already sexual if I didn't say anything. Sometimes, yes, sometimes we lean on the side, that rib is jammed. We're working on that side position, or at least I'm gonna let the client know I'm gonna work on that rib cage, but I'm never go up to chest, and it's always draped. It's someone undrape you, and like I said, it's something not there. Okay, what else we can do? It's a lot of questions about personal life. It's when the therapist is like, start telling about himself, or the therapist come in and like, half naked, like all this kind of stuff. It's already telling me it's going to be something sexual. And like I said, it's not appropriate in a massage therapy profession. It's other services. Yeah, I'm fine with that. But if you go to massage therapy, it's not supposed to happen. And if it's happened, please report it and tell this to connect to police, maybe Massage Association. It's a CMTA, California Massage Council. They can check the license. They check this person. So don't ignore that and don't just like forget about this. No, it's have to be treated. These people have to be go through specific programs. See if they like even not mentally ill, because it's like I said, it's a lot of stuff up there. So yeah, and finally, California become a healthcare provider. We're not adult entertainment anymore.